Chiropractic management of dizziness. The public and most healthcare professionals view chiropractic patient management as limited to musculoskeletal problems, yet many chiropractors report success with other complaints. One explanation is that what may seem visceral in nature actually has a biomechanical or neurological cause. A new review evaluates one of these potential overlaps: dizziness. The title of the publication we will review is The Role of Chiropractic Care in the Treatment of Dizziness or Balance Disorders, Analysis of National Health Interview Survey Data, published in the Journal of Evidence-Based Complementary and Alternative Medicine in 2015. Previous to this review, there were small reports beginning in the late 1970s and early 80s specifically related to whiplash-associated dizziness, often mislabeled as Meniere's. This was followed much later by some small studies and some reviews by Hawk et al. This review is the first large survey-based national report. First, let's cover some basic statistics and descriptions. The overall prevalence of dizziness and balance problems is 5% to 10% in younger adults and more than 30% among older adults. In the latest MBCE Practice Analysis Survey, chiropractors report that they see approximately 1 to 3 patients per month with a complaint of dizziness. What isn't clear is how often the underlying cause is related to a spinal source, in other words, cervicogenic dizziness, or as is often termed, cervicogenic vertigo. It's important to clarify terms here. Although vertigo could be used for any description of dizziness clinically, it's usually interpreted as meaning spinning and the source being vestibular. As it turns out, it's uncommon for someone with cervicogenic vertigo to describe the dizziness as spinning, but more often as being off balance. Dizziness is obviously more a concern in the senior population due to the risk for falls. Surprisingly, falls are responsible for 2/3 of all unintentional injuries in older adults, and unintentional injuries are the 5th leading cause of death in older adults. For the prevention of falls, the American Geriatric Society recommends exercise programs that focus on improving strength, gait, and balance, such as Tai Chi or physical therapy, as well as vitamin D supplementation. This is a general recommendation with a focus on strength and balance, but does not address necessarily the underlying cause. Certainly, the management of dizziness should also be based on the type. These can generally be divided into vestibular, proprioceptive, and vascular. The underlying cause of each are multiple, yet for vestibular there is a limited number of common causes, including benign paroxysmal positioning vertigo, vestibular neuritis, and Meniere's. For proprioception, the main causes include diabetes due to its effects on proprioceptors and nerve endings, myelopathy due to blockage of spinal cord transmission, and possibly cervical neck trauma due to potential damage to proprioceptors in the upper cervical region. Vascular causes include orthostatic hypotension, whose main causes include again diabetes and various medications, the most common being antihypertensives. Now back to the study. The researchers used data from the National Health Interview Survey in 2008, which is composed of a random sample of 21,781 participants who are civilian, non-institutionalized persons in the U.S. The approach using the National Health Interview Survey was first to ask participants if they had dizziness or balance issues, then ask about associated health conditions and their perceptions related to causes and effects of the dizziness or balance problem. Also, they were asked about their use of specific healthcare practitioners for dizziness and balance, the total number of practitioners seen, and the effectiveness of that care. Practitioners included a general medical physician, neurologist, osteopathic physician, psychiatrist, ear, nose, and throat specialist, nurse practitioner, chiropractor, and occupational or physical therapist. They were also asked the length of time between when they first saw the professional and when they felt helped, and the current status of the dizziness or balance problem, whether it had worsened, remained the same, or improved in the last 12 months. Specifically, participants were asked about types of treatment, including the following list of treatments: exercise or physical therapy, over-the-counter and prescription medications or drugs, and complementary and alternative modalities, including chiropractic treatment or manipulation. There are some interesting results. 11% of participants reported having a balance or dizziness problem, most of which occurred every day and lasted less than 24 hours per spell or bout. 28.84% noted that the problem prevented them from engaging in any activity within the last 12 months when it occurred. 51 days were reported as the average for missed days for work or school within the last 12 months. Interestingly, only about half of individuals with dizziness or balance problems sought care, and only about 2/3 of those who sought care from a healthcare professional were given a cause or diagnosis for the balance or dizziness problem. 4.2% of patients reported receiving care from a chiropractor for their dizziness or balance problems. A higher percentage, 7.2%, received chiropractic care regardless of whether it was for a dizziness or balance problem. And for all who received chiropractic care, there was a 50% increased likelihood of the dizziness or balance problem being helped rather than not. What is insightful is a comparison of GP versus chiropractic care. For those who saw a general practitioner, the odds ratio for reporting having been helped was the lowest at 0.95. For those having seen a chiropractor, the odds ratio of perceiving being helped was the highest at 1.73. Age was a determinant. For the 35% of respondents who were aged 65 years and older, the odds ratio for rating having been helped by a chiropractor was 4.36, compared with an odds ratio of 1.13 for those younger than 65 years of age. Remember that participants were asked about what they felt was the cause of their dizziness. The categories included trauma, inner ear infection, neurological, or a side effect of medicine or drugs. For patients reporting head or neck trauma as a cause, the odds ratio for perceiving that they had been helped by a chiropractor was 9.5, compared with an odds ratio of 0.53 for medical physicians. For those reporting neurological or muscular conditions as the cause, the odds ratio for being helped by a chiropractor was 13.78, although the confidence interval was wide. A majority, 60.45% of the respondents with balance or dizziness problems, received care from multiple sources or providers and reported on average 480 days between when they first saw any provider and when they first perceived help. This delayed period seems curious. It's not clear from how the question was asked or how responses were reported by the researchers whether this represents being helped after a single episode or cluster of occurrences to the point of resolution. Otherwise, even as a natural history of resolution, this time period seems exceedingly long. It would not seem to represent any relationship to being helped by any type of care. Only 20.7% reported that they received chiropractic care or treatment alone, and noted on average 54 days between when they first saw the chiropractor and when they first perceived help, compared to 256 days to improvement for those not seeing a chiropractor. Again, this seems unfortunately to be a long period of lag time between care and relief. In total, about 49% reported having some improvement with chiropractic care. It's important, as usual, to point out some limitations. Given this is a survey, the data is based on the patient's interpretation and memory. Only 53 patients saw a chiropractor for their dizziness or balance problem, and although 98 ended up seeing a chiropractor, most patients received care from multiple providers, with only 11 receiving chiropractic care exclusively. This then dramatically influences the statistics, with even one patient perceiving improvement or not, markedly changing the statistical result. Conclusions? So even with these limitations, we can say that this represents a large sample of the U.S. population and that it points in the direction of demonstrating that chiropractic management of dizziness has a potentially significant impact on those who choose chiropractic care. It's also clear from this study that the effectiveness is related to cause. When trauma, neurological, or muscular sources are reported as the underlying cause versus medication, infection, etc., response rates are significantly high. The future? This survey data hopefully will generate some clinical research in an attempt to determine the types of dizziness chiropractors are most beneficial with and which treatment approaches fit each type.